1. Which cytokine induces Th1 differentiation from CD4 plus T cells? A. Il-2.B, Il-4.C, Il-12.D, IFN gamma. Correct answer, C. IL-1-2. Explanation. IL-1-2 from macrophages causes CD4 plus cells to differentiate into Th1 cells, which then activate macrophages and other cell-mediated immunity mechanisms. Q2. In which part of the respiratory system does gas exchange primarily occur? A. Bronchi, B. Alveoli, C. Trachea, D. Nasal cavity. Correct answer, B. Converts macrophages into epithelioid histiocytes. Explanation. IFN gamma secreted by Th1 cells activates macrophages to transform into epithelioid histiocytes and multinucleated giant cells, forming granulomas. 3. DiGeorge Syndrome results from failure of which pharyngeal pouches? A. First and second, B. Third and fourth, C. Fourth and fifth, D. Second and third. Correct answer, B. Third and fourth. Explanation. These pouches develop into thymus and parathyroids. Failure causes T-cell deficiency and HYPOCAMIA. 4. DiGeorge syndrome is caused by which genetic abnormality? A. Trisomy 21B, 22q11 microdeletion, C. X-linked recessive gene, D. 15q13.3 duplication. Correct answer, B. 22q11 microdeletion. Explanation. Microdeletion of chromosome 22q11 disrupts pharyngeal development, resulting in DiGeorge syndrome. 5. What triad of symptoms is common in DiGeorge syndrome? A. B-cell deficiency, eczema, thrombocytopenia, B. T-cell deficiency, hypocalcemia, cardiac defects, C. Hyper-IgM, anemia, recurrent infections, D. Splenomegaly, anemia, arthritis. Correct answer, B. T-cell deficiency, hypocalcemia, cardiac defects. Explanation. Caused by thymus and parathyroid.APL-ASIA plus cardiac great vessel malformations. 6. What is the primary immune defect in SCID, severe combined immunodeficiency? A. Neutrophil inactivity, B. Defective T and B cells, C. Overactive macrophages, D. Increased NK cells. Correct answer, B. Defective T and B cells. Explanation. SCID affects both arms of adaptive immunity, making patients vulnerable to all types of infections. 7. Which enzyme deficiency is associated with SCID? A. Adenosine deaminase, ADA, B. Glucose-6-PHOS-PATASE.C, NEURAMINIDAC.D, alkaline phosphatase. Correct answer, adenosine deaminase, ADA. Explanation. ADA deficiency leads to toxic accumulation of adenosine, killing lymphocytes. 8. X-linked Agammaglobulinemia results from mutation in which gene? A. CD40L, B. FOXP3.C, rutin tyrosine kinase, BTK, D. IL-7 receptor. Correct answer, C. Rutin tyrosine kinase. Explanation: BTK is essential for B-cell maturation. Without it, then immunoglobulin production fails. 9. Patients with X-linked agammaglobulinemia are most vulnerable to which infections? A. Viral infections only, B. Protozoal infections only, C. Bacterial and enterovirus infections, D. Fungal infections only. Correct answer, C. Bacterial and enterovirus infections. Explanation: due to lack of antibodies, patients cannot opsonize bacteria or clear enteroviruses. 10. Which immunodeficiency is most commonly asymptomatic and involves IgA? A. Hyper-IgM Syndrome, B. SCID, C. IgA deficiency, D. CVID. Correct answer, C. IgA deficiency. Explanation: though often silent, some patients have mucosal infections due to lack of IgA. 11. Hyper-IgM syndrome is caused by a defect in A. CD40 ligand or CD40 receptor, B. Bruton kinase, C. IRA gene, D. FOXP3 gene. Correct answer, A. CD40 ligand or CD40 receptor. Explanation: without CD40-CD40L interaction, B cells can't receive signals for class switching, leading to excess IgM and low IgA, IgE. 12. Patients with Hyper-IgM syndrome suffer mainly from infections at colon.A, skin only, B. Mucosal surfaces, C. Nervous system, D. Bone marrow. Correct answer, B. Mucosal surfaces. Explanation: because of low IgA and IgG, important in mucosal defense, these patients often get respiratory and GI infections. 13. Which triad characterizes Wiskott-Aldrich Syndrome? A. Eczema, thrombocytopenia, recurrent infections, B. Autoimmunity, fever, rash, C. Diarrhea, weight loss, hyperglycemia, D. Fever, lymphadenopathy, seizures. Correct answer, A. Eczema, thrombocytopenia, recurrent infections. Explanation: osteoclasts break down bone tissue during remodeling and help maintain calcium homeostasis. Osteoblasts, in contrast, build new bone. 14. Wiskott-Aldrich syndrome is inherited as A. Autosomal recessive, B. Autosomal dominant, C. X-linked recessive, D. Mitochondrial. Correct answer, C. X-linked recessive. Explanation: it affects males and is linked to the X chromosome, causing combined immunodeficiency and bleeding. 15. Deficiency of complement proteins C5 to C9 increases risk of colon.A, staphylococcal pneumonia, B. Candida infections, C. Neisseria infections, D. Tuberculosis. Correct answer, C. Neisseria infections. Explanation. These proteins form the membrane attack complex, MAC, important against Neisseria species. 16. What is the main feature of hereditary angioedema caused by C1 inhibitor deficiency? A. Fever and joint pain. B. Skin and mucosal edema. C. Severe anemia. D. Bleeding gums. Correct answer, B. Skin and mucosal edema. Explanation. Absence of C1 inhibitor allows excessive bradykinin activity, causing localized, often periorbital swelling. 17. A defect in IRA gene results in a X-linked Agammaglobulinemia. B. Autoimmune polyendocrine syndrome. C. Hyper-IgM Syndrome. D. SCID. Correct answer, B. Autoimmune polyendocrine syndrome. Explanation. IRA is essential for negative selection of T cells in thymus. Without it, self-reactive T cells survive. 18. FOS pathway mutations cause which autoimmune condition? A. IPEX syndrome. B. ALPS, autoimmune lymphoproliferative syndrome. C. Lupus. D. Meze. Correct answer, B. ALPS. Explanation. FAS is critical for T-cell apoptosis. Defects lead to accumulation of lymphocytes and autoimmunity. 19. Which two cytokines are secreted by regulatory T cells to suppress autoimmunity? A. IL-2 and IL-4. B. IFN gamma and TNF. C. IL-10 and TGF beta. D. IL-1 and IL-6. Correct answer, C. IL-10 and TGF beta. Explanation. These are anti-inflammatory cytokines produced by Tregs to suppress immune responses and maintain tolerance. 20. FOXP3 mutations are associated with A. DiGeorge Syndrome. B. IPEX Syndrome. C. Common variable, Immunodeficiency. D. Wiskott-Aldrich Syndrome. Correct answer, B. IPEX Syndrome. Explanation. FOXP3 is essential for regulatory T-cell function. Its mutation leads to widespread autoimmunity and endocrine dysfunction. 21. What is the primary mechanism of tissue injury in SLE? A. T-cell cytotoxicity. B. Immune complex deposition type 3 HSR. C. Antibody-mediated cytolysis type 2 HSR. D. Cell-mediated granuloma formation. Correct answer, B. Immune complex deposition type 3 HSR. Explanation. In SLE, antigen-antibody complexes deposit in tissues and trigger inflammation, causing multi-system damage. 22. Which complement deficiencies are associated with increased risk for SLE? A. C5, C9, B. C3 and C5, C. C1q, C2, C4, D. C1 inhibitor. Correct answer, C. C1q, C2, C4. Explanation. These early complement components help clear apoptotic debris. Their absence promotes autoimmunity. 24. What renal lesion is most common and severe in SLE? A. Membranous NEET-PG. Minimal change disease. Diffuse proliferative glomerulonephritis. D. Focal segmental sclerosis. Correct answer. C. Diffuse proliferative glomerulonephritis. Explanation. This lesion is associated with hematuria, DOT, and proteinuria and has the worst prognosis in lupus nephritis. 25. Liebman-Sachs endocarditis is a feature of A. Bacterial endocarditis, B. SLE, C. Rheumatic fever, D. Sarcoidosis.
Correct answer, B. SLE.
Explanation. Liebman-Sachs is a sterile, non-bacterial varicose endocarditis seen in SLE patients, typically involving mitral valve. Thank you for watching.